So at this point, I'm looking for the high sign about Xavier Morales and hoping that we can hear from him in just a moment. So Xavier, are you there?
Can you hear me?
Yes,
Hello?
bravo. Okay, the floor is
Our,
yours.
well, the next step is to share my screen. I'm not sure what it looks like over there, but here we go. Can you guys see my screen?
Not just yet.
Okay. While it's getting pulled up, I'll just start with, my name is actually Javier Morales. It's spelled Xavier, but since I was a kid, it's always been Javier. And I'm the executive director for the Praxis project. And the Praxis project, we are a national technical assistance and or technical assistance training and capacity building entity that works with community groups across the country that are working to build power in communities to improve health. And that's a mouthful. But we're working across the social determinants of health. And I'm real excited to be here with you guys, and just wanted to thank everyone that helped make it possible. And I apologize for not being able to be there in person. We had a previous staff retreat that I could not work a personal appearance over there out of. So thank you for being accommodating. Can you guys see the screen now?
We can, and we can see you, so that's terrific.
Oh, great. Hi. Berkeley versus Big Soda, leading with health justice. And it's been very interesting for me to be listening, and I've been listening in for about an hour on the conversation. And I'll start out with like what it seems everyone's starting out with. I am not a tax expert, but I'm here to learn as well. But I do think that we have some very strong lessons that were learned in the Berkeley versus Big Soda campaign. As many of you know, the first time a municipal tax was passed in the country after 30 different attempts. And the thing about the Berkeley versus Big Soda that I feel was different, and as I study more of what's happening across the country, what has happened, is that we really did lead with health justice. And I appreciated the previous speaker talking about the need to have folks who are most impacted at the table. Because I've heard this twice now, if you're not at the table, you're on the menu. And to be honest, we feel like that quite a bit. Since Berkeley has passed its tax, Oakland also passed a tax. San Francisco did as well, and Albany, the little Albany, just north of Berkeley, also passed the tax. All of these were done through voter the ballot, and then taxes were also passed in Philadelphia and Seattle, and also Cook County, but that was more through commissions and councils. And the one in Cook County, the Chicago one, was actually repealed. And I have strong reasons for why I feel that happened, and one of the biggest ones was that it was not an organic enough campaign that engaged communities to the level where there would be defenders for the policy. But that's a whole different presentation that I have. So Berkeley won. We won, and the election was actually held in November of 2014, but we had started meeting and negotiating amongst our leadership team a year and 3 months beforehand. And I always want to make sure I give credit to folks, because even though I'm sitting here giving this presentation, there was some folks I want to mention. Is Josh Daniels, who's on the council, school board, Lori Capitelli, Linda Mayo, Daryl Moore, who were all on the council, Vicki Alexander, former health officer for the city of Berkeley, and also Martin Bork, who is the director of the Ecology Center. They could all be giving this presentation just like I am here. We won. And how did we do it? Or why did we do it? The reason that we did it, the way we were able to engage communities, is that we could quantitatively show that we were having health disparities issues in Berkeley. And we do this health status report every couple of years, and the one from 2013 showed that 40% of ninth graders were overweight, with students of color much more likely to be overweight and obese. And, we wanted to fund some nutrition. We wanted to address this. The school district had a USDA grant that was running out, and we needed to replace that. And so the initial thought was, you know what, let's replace that by doing the soda tax, and we can fund the nutrition education programs in the Berkeley Unified School District. But there were a number of us that said, you know, that sounds great, but we would also like to make sure that we're directly addressing the communities that are being affected the most medically by the impact of the overconsumption of sugary drinks. So we want to also include healthy food access and early childhood nutrition programs. We want to make sure that they have sustainable funding as well. So in the months before we actually put the language down, there was a lot of negotiation that happened. And this is what it means to be actively involved. And I should also take a step back. When I talk about health justice, this is the next step for me beyond health equity. When we talk about, you know, equality, you know, everyone has the same pair, everyone gets a pair of shoes. Health equity, all the shoes fit. Health justice means that the shoes also help the person that's wearing them navigate the terrain and the environment and are suited to them, their personalities, their identities. So it's the next step from health equity. So these were our concerns. If we come out and we just fund cooking and gardening programs in the schools, you know, we felt like this was going to add to the gentrification pressures. We also felt like this would reinforce the educational disparities that already existed in Berkeley between students of color and mainstream students. We also felt like if we were going to hold up the rates of disease in African American and Latino kids as the reasons why we needed this tax, then we should show that the revenues were actually going to go back into the communities. And we wanted to leave capacity and build resilience. We didn't just want to reduce consumption of sugary drinks by raising the price so that price-sensitive populations would cease the purchase. We wanted to leave something behind. We wanted to build capacity, build resilience, and just raising the price wasn't going to do that. So here were some of the challenges. So internally, to pulling together our coalition. So we had folks that were internal that, you know, were very gung-ho on funding school-based cooking and gardening programs, and we were like, okay, we got to make sure we have that consideration. We had folks that, like me, that wanted to invest in communities most affected by chronic diseases that result from the overconsumption of sugary drinks. Yes, we had to navigate that as well and incorporate that. And then we also had a number of external folks that were looking at what we were doing that truly believed we just needed to raise the price of sugar-sweetened beverage so that price-sensitive residents would choose cheaper alternatives, or healthier alternatives, I should say. And also in Berkeley, the People's Republic of Berkeley, there were a number of people that just wanted to beat big soda. They were in it for the fight, for the anti-corporate fight. So, you know, by having us at the table, these diverse interests, diverse leadership at the table, this is how we changed the strategy. So mainstream public health perfect, which was, I got political bad here, maybe that bad is too strong a word, but public health perfect, the strategy that had failed 30 times, said that we needed to raise the soda price 2 cents per ounce. It had to be a dedicated tax. And I don't know if you guys are distinguishing it over there for what a dedicated tax versus a general fund tax for the non-California folks. Also, it has to be at a retail tax. They wanted people to feel it at the register. They wanted that when you looked at the shelf, you would see a price differential between regular soda and diet soda. And again, it was focused on raising prices to curb demand and consumption. And success was defined by if the soda price increased and therefore consumption would go down. But a big part of success was if the price of soda increased. So Berkeley, the leadership team, what we did is we sat around and we debated every single one of these. And what we were trying to do is, okay, public health perfect hasn't won. And what do we need to do here? We know our community. What do we need to do here to win? And so I'll call this the Berkeley political perfect, and it's a public health good. It's not public health perfect anymore. So we went with the 1 cent per ounce tax. We went with the general fund tax, which required us to only win at 50%, but we wrote into the measure that we would have a panel of experts that would advise council on how to invest the funds. It's going to be an excise tax that's paid at the distributor level, and it's focused on generating revenues to address the complex-rooted diseases caused by the overconsumption of sugar water. And success is defined by increasing community knowledge and behavior changes of folks receiving benefits of the investment. So this is a little, quite a bit of a strategy shift for us in Berkeley. And the other thing that we did, by the way, I was on the strategy team for the Berkeley versus Big Soda, but I also served as, I was on the commission, and I was actually the chair of the commission making recommendations to council up until about 2 weeks ago. So as we developed how to make the investment, we made sure that we wrote in priority populations. And this is that piece about making sure the funds go into the communities where this is needed the most. And secondly, again, if you're going to hold up communities of color as the reason why you're doing this, we really do need to codify that the money is going to go into those areas. So if you apply for money from Berkeley, in the request for proposal, we have priority populations. And these are the ones that we came up with. Children and families with a particular emphasis on young children who are in the process of forming lifelong habits, individuals with limited resources, groups exhibiting higher than average population levels of diabetes, obesity, and tooth decay rates, and groups that are disproportionately targeted by the beverage industry marketing. We actually have this in the request for proposal. And so, long story short, we won. And after the first year, this is the revenues that we received after the first year. First taxable year, we got $1.4 million. Extending it out for another 4 months there is $2.085 million. Our monthly average was about $118,000 that we were capturing. So Berkeley has about 100,000 people, and the rule of thumb that we used, and it's proven to be relatively accurate, is for every 100,000 people in the community, you can expect $1.5 million in revenue. And then the 2016 monthly average was 128,000, and that went up a bit. And the tax filers' information there was, in the first year, remember, it's the distributors paying, so we captured all the large distributors there was 44 of them. And then the second year, we went and got the smaller retailers also involved, so we got another 100. But you see it didn't raise the revenues that much, the monthly average that much, because they were so small. And after the first year, this is the way we decided to invest. We made these recommendations to council, and the council actually took all of our recommendations and approved it. So $637,400 to support school-based nutrition education and cooking classes through the Berkeley Unified School District. And then, so that was actually about 42%. And then another 42% went to support community-based efforts to increase awareness and change norms and practices. And so a significant amount of funds went to Healthy Black Families, also to the Ecology Center, the YMCA, and Berkeley Youth Alternatives. And again, this was the first year of investments. The second year of investments, so what we were able to do also is it's really hard for small community groups to staff up and operate on a 1 year grant. So what we did is we asked for and received from the council $3 million over 2 years so that we could make 2-year grants. And so the first round got funded this past May, and these are the numbers that we put out. And again, about 42.5% going to Berkeley Unified School District, another 42.5% being split amongst all these community programs. And then we also gave the Berkeley Public Health Division about 15%, and the reason for that, to administer, which was about 10%, we also gave them an extra 5% so they could cooperate with evaluators. So evaluations to date, let me just doing a quick time check. Okay, evaluations to date, what we're seeing is that the pass-through rate is 43.1% across all brands and sizes of the study. So for every penny that's raised, only 43.1% were passed. And stores in Berkeley located further from the border of neighboring cities shifted more of the tax on the consumers compared to those closer to the border of the city. That was that leakage question. But now that Oakland and Albany have also passed the tax, I'd be curious to see what this data actually shows now. Falvey and Rojas, they did a study in 2015, 3 months after the tax was implemented. So, this isn't a lot of data, but what they found was that the price of soda in Berkeley increased by 69% per ounce for single-size servings, and the overall retail prices increased more in Berkeley than in comparison cities. Pass-through was highest for soda, and across retailer types, drugstores had the lowest pass-through rate. So think of your Walgreens, CVS's, and possibly because their pricing was regional. Another, the same team in 2016, they found that the consumption of sugar-sweetened beverage decreased 21% in Berkeley and increased 4% in comparison cities. Water consumption increased by 63%, and only 2% of people who purchase sugar-sweetened beverages in Berkeley pre-tax reported buying them in another city post-tax. And 22% of participants reported changing drinking habits as a result of the tax. Silver, I heard Mary Pittman talk, that this is Lynn Silver from her place. Across all sugar-sweetened beverages, 67% of the tax amount was passed through, but more of it was but that it was more fully passed through for both sodas and energy drinks after 1 year of tax implementation. And when they studied 26 retailers in Berkeley, the tax was fully passed on in large and small chains and gas stations, but partially passed on in pharmacies. And sales in ounces decreased, and did not notice significant changes in behavior consumption and beverage consumption, knowing that Berkeley residents consumed a lower amount of SSBs at baseline, and did not find evidence of higher grocery bills. And any of you that have engaged in the campaign, on the sugary drink campaign, will know that that's one of the first things that the beverage industry comes out with. This study focused on the UC campus, so it's just students. Sales of soda declined by 30%. They also estimate that soda sales remained depressed after the tax was implemented on campus, and also note that the campus retailers did not pass the tax on to consumers until after a year. So all of these changes actually happened before the tax was implemented, which leads us to believe that there was a lot of community education that happened as we worked really hard to mobilize all of our communities across the city to help us pass the tax. Leading with health justice and having folks at the table will significantly transform the ideas for the measures, the legislation, the campaigns. And not only does it do that, it also generates support and goodwill and power. I mean, it generates community power to buy in to help this. And I went door to door a lot in the days leading up to the months leading up to the election, and there was talk about regressivity. But you know what? The community felt that if the money was going to be coming back into the community, they were okay with it. What they didn't want was, for example, I think it was in Cook County, where the revenues from the tax was actually going to the sheriff's department. And so if it's communities of color that are bearing the burden of paying the tax, you got to make sure that they're comfortable with where the monies are going. A lot of times in my community, the relationships with law enforcement are not that strong. And so for them to feel like their funds were going to fund someone that was not really helping in the community, that it wasn't a good thing. So, the one thing I drive home is just the importance of health justice and having folks in on the process as early as possible, not after the measure has been written to ask people's input. Have them in at the point where the measure is actually being written. So thank you very much.
Thank you, Javier, for that really wonderfully specific and practical guide on that huge success. So Meredith Valley, would you like to come on up?